Okay, wonderful. Good morning, good evening, and good afternoon, everyone. We're going to give folks a couple of minutes to join. I see the numbers going up, so we'll just wait a couple of minutes before we kick it off. And thank you for joining today's webinar. Okay, I see we have substantial number right now. So good morning, good evening, and good afternoon, everyone. Welcome to today's webinar, Unpacking the Power of Localization. My name is Dr. Mariam Reda. I'm a Senior Health System Strengthening Advisor at Abt Associates. This is the second webinar in a series of webinars that Abt Associates is sponsoring, focused on the future of health systems. The first webinar focused on primary health care, and this webinar focuses on localization. We aim to bring practical solutions, diverse insights, and actionable strategies for strengthening health systems. I am delighted to have you all join today's webinar with the aim to provide an in-depth understanding of the localization concept and its implication on health system strengthening. In this webinar, we have assembled a panel of esteemed experts who will provide us with an understanding of localization and its significance on health systems from multiple perspectives. Our speakers will explore the implications, opportunities, and challenges that arise from implementing localization strategies in health programming. We will explore strategies and approaches that foster locally led initiatives, empowering communities and organizations to drive their own priorities while ensuring sustainability and inclusivity in health interventions. I will start by introducing our esteemed panelists who have extensive expertise and contributions in supporting the health system. I hope I do justice, but I doubt. We will start with Dr. Mai Hijazi. She is the director of USAID's Office of Health Systems in the Bureau of Global Health. She recently served at USAID's Office of HIV/AIDS as Division Chief for the Systems and Programs Sustainability Division, where she led technical branches covering finance and economics, health workforce, transition to local partners, and private sector approaches. Her work under PEPFAR focused on advancing USAID's role for HIV-sustained epidemic control, health system strengthening, and leadership and programmatic coordination for the PEPFAR-funded Sustainable Financing Initiative and USAID's Local Partner Transition Initiative. Then Dr. Mercy Mwangangi is the co-chair of the Future of Global Health Initiatives. Dr. Mercy is a health economist and a policy analyst with a background in medicine. She has knowledge and experience in performing high-quality strategic health program planning, monitoring and evaluation activities, focusing on universal health coverage and primary health care, with considerable experience in carrying out in-depth health situation analyses and producing workable recommendations and guidelines on future program direction while incorporating international policies and standards tailored to local needs. And finally, Dr. Kumanan Razananthan is the Executive Director of the Alliance for Health Policy and Systems Research at the World Health Organization. He's a public health physician with a strong background in health policy and systems research, and extensive experience working at different levels of the WHO and within the wider UN system. During his 25 years working in health systems, career highlights have included serving as incident manager for WHO for the COVID-19 response in Cambodia, helping to drive the development of Sustainable Development Goal Health Agenda while at UNICEF, contributing to the work of the WHO Commission on Social Determinants of Health, and co-writing the 2008 WHO World Health Report on Primary Health Care. In a world marked by dynamic shifts and emerging challenges in health development, the need for innovative approaches has never been more pronounced. Throughout this insightful discussion, we will showcase practical cases, and our panelists will share their expertise with the aim to dissect the intricate mechanisms by which localization can transform health interventions into impactful initiatives, yielding sustainable impact and equitable progress. Throughout the webinar, our experts will share their insights and recommendations to drive meaningful change in the field of health system strengthening, emphasizing locally led development. We value your participation and look forward to engaging with you in this interactive question and answer session following the panelists' discussion. So please feel free to engage by submitting your questions in the chat box throughout the webinar. And I would like to inform you that this webinar is being recorded for future reference and for the content to be accessible for those unable to attend at a later time. So maybe we can kick it off with the first question to our panelists. There has been an increasing emphasis lately on the concept of localization in development work. Can you share what excites you the most about this concept and what you or your organization are doing to unpack the power and potential of localization? And maybe we can start with Mai.
Great. Thank you so much, Mariam, for the introduction, and a big thanks to ACT for inviting me to join this important conversation on localization. So really happy to be here to be part of this webinar. So localization is fundamentally about putting local contexts, aspirations, dynamics, organizations, and change agents at the center of our programming. It's about recognizing that development agencies like USAID do not direct change, rather support or catalyze local change processes. We know as practitioners in health that we work in complex, dynamic settings, trying to support countries to resolve challenges unique to their communities. For USAID, that means our support should be tailored to where those countries are at, their unique contexts, and where they want to go based on their national priorities. Localization, in terms of how we're approaching it, is an institution-wide change at our agency. It's not just a set of targets, it's a new way of doing business. Localization at its core is about changing relationships and engagement so that local actors are at the center of our work. To do this, we need to continue to change our perspectives, behaviors, practices, and procedures. Administrator power, as many of you may know, established two important goals for localization. The first, by 2030, our goal is that 50% of USAID's activities across our development and humanitarian portfolios will put local communities in the lead to co-design a project, set priorities, drive implementation, or evaluate the impact of our programs. And then second, by the end of fiscal year 2025, that at least a quarter of all of our obligations will go directly to local organizations. So maybe I'll just stop there, Mariam. That gives an overview, and looking forward then to participating in the next questions. Thanks so much.
Thank you so much. Dr. Mercy?
Thank you, Mariam, and it's a pleasure to be here, and thank you to APT for setting this up and inviting us to share our perspectives. I work for Amref as the Senior HSS Director, and for us, I think, the whole agenda is sort of smack dab in time for our refresh of our corporate strategy. And one of the key elements, that is important to us as Amref is increasing relevance and impact of our programs. And one of the things that we've determined that will enable us to really scale that impact and increase the relevance of what we do is to have communities at the center of our programming. And so really, it's an exciting time. It has caused us as an organization to really reflect on what that essentially means in the way we program, in the way we put in place processes, in how we engage communities, in how we create a feedback loop from communities in terms of our programs. And so it's really exciting for us. And I think as a 60-year-old organization that's been centered on communities, We're seeing this new phase of our corporate strategy as the one that will really, really, should I say, become very granular in what essentially that means to the UHC journey for the different countries who we partner and serve. Thank you.
Thank you so much, Dr. Mercy and Dr. Kumanen.
Hello, everyone, and thank you to Mariam and Kelly for the invitation and to APT for organizing this. I think what I'm excited about, and it's so welcome, I mean, thank you, Maya, and a credit to Administrative Power for really taking USAID further in this direction. I think what I'm most excited about is that there's a renewed momentum to do something, okay, we can call it localization now, that we've long been committed to. I mean, in the 13th century, Thomas Aquinas was writing about subsidiarity, building on Aristotle, right? The idea that decisions should be made closest to where people are affected, right? And that you should only go to a higher level where it really adds value. So I think we've been talking about this for a long time. It's central to the principles of Almirata about community participation, about community leadership and the governance of health systems. So we've been talking about this for a long time. I think there's many great efforts and experiences, but we've struggled in global health to institutionalize this, to really support people to seize power over their own health. So at the Alliance for Health Policy and Systems Research, I think this very much is aligned with our history and our values, but also we're doing a new strategy where we want to go forward. And in our values, one of our key values and approaches is on co-production. And that really is saying that you cannot support effective research that can influence policy and implementation unless it's really produced with and led by the people who know most about the problem. And so one of the things that we do is we invest in institutions and countries who can play that brokering role between policymakers, research, and also with communities. And researchers themselves have a responsibility. Researchers sit and are from communities, but sometimes there can be a distance. So how do we really support community-based researchers to equally, we need all of these groups of people. I think the other thing that we're really trying to do is sort of invert the thinking in global health and as a global institution, really provide a platform to take forward and support those local and national voices to dominate our thinking and our discourse, rather than often when it happens the other way around, an idea at global level, then it's like, well, what can you do with that at country and local level? And I think finally, one of the things that we are very involved both with the Alliance and our community is focusing on equity in research production itself, looking at the power, looking at who makes decisions, who is at the table, who determines what gets researched, who defines the research questions, and ensuring that local voices, community voices, brokering with national institutions are really leading the way, and we and other global partners are providing support.
Thank you so much. I really appreciate the common approach in terms of putting communities and people's voices front and center, not only in the design of health intervention, but also in the policy dialogue and in research, in an effort to try to change perspectives, behaviors, and practices, which is challenging, which is not easy. And so with localization emphasizing a lot the need for locally led initiatives and empowering those communities and organizations to drive their own development. Now we want to dive a little bit more into the question of how. And it would be great if you can share with us specific approaches, strategies, or any promising practices that you have experienced or that your organizations has experienced that you can recommend for for us and the global health development community overall to be able to achieve these strategies and really change those behaviors, those perspectives, and put local actors at the table in a meaningful manner. And so maybe we could start with you, Kumanen.
Great. And I mean, I think for us, it's a real focus on institutionalization of this approach, because I think in health, we have many experiences of inspiring local successes. We have inspiring local leaders, but we don't often invest enough in the institutions to sustain locally led leadership and decision making. So often it's down to specific individuals or specific institutions, but then often it's hard to sustain those. So there's two things that we do, and I mentioned them briefly before. I mean, firstly, is a commitment to co-production. The ties, as many of you know, talk about the triangle that moves the mountain, and they say that to achieve change and social change, you need the three corners of the triangle. Yes, you need government, the policymakers and governance. Yes, you need the academics, you need researchers, you need the knowledge, but you need social mobilization, you need the people, you need communities, and you need all three, and they overlap. And I think our approach to co-production very much reflects that approach, which is, as I said, who are the brokering institutions? Who are the brokering leaders who have credibility between spaces, who can bring together the access to policymakers at the national level or even resources at the global level, who can bring together the access to the knowledge and generate research and undertake research, but also have credibility with communities, defining their needs, affirming communities' rights, really understanding the context. And I think that that differ. It won't be the same institution in every country. And this is where understanding the local context, this is why, again, having local leadership and where resources go and identifying which institutions have the confidence of those communities, but then working alongside. And I think one of the things that we are doing in terms of co-production is continually pushing researchers to get beyond their comfort zone and not just be content with writing papers or reports and seeing as that as an endpoint of research, but asking throughout the process, what difference are you making to the issues in the communities in which you are located, and really fostering and supporting the capacity of institutions to build that capacity, that credibility, that approach. And we call that things like embedded implementation research or participatory action research. But I think the approach is very much what we're discussing today. So building that idea of co-production. Secondly, is about sustainability. It's in what we call accompaniment as a value. This idea that these things don't happen overnight, and often in global health, for various reasons, there's an influx of support, but then there's a rapid departure. Often our budget cycles are not so sympathetic for sustainability. So really thinking, how can we be creative within the limitations that we face in sustained engagement with key institutions, community leaders, policymakers in countries, and thinking how we can be creative to say, well, even if we cannot guarantee you sustained funding this year, how can we work with our partners? How can we encourage a coordinated approach? It's the sort of principles that are in the Paris and Accra Accords. So these aren't new, but we have struggled as a global community. So I think, again, the commitment from USAID, Administrator Power, and people like Mai is just so welcome, because it will make a big difference. And we really look forward to working with people like USAID, people like Amref, who know the community, to sort of put in practice co-production and accompaniment. I think we have a lot of good experiences, but we really want to go further. And I think one of the things that important for institutions like us is to be very clear in our prioritization that this is where we want to go. And that's, again, where USAID's leadership is very welcome.
Thank you, Kuman. And I appreciate you mentioning the need for us to get out of our comfort zone, to identify the right actors, the right institutions, and build community trust. And I think maybe Dr. Mercy would have a lot to say about this. So Dr. Mercy, over to you.
Thank you. Thank you. And I couldn't help but just, really continuously nod my head as Kuman was going, because I really do agree with everything he's saying. And I just want to share a few examples in terms of how Amref has been able to institutionalize localization. And I think the first one is essentially what he discussed, ownership and leadership. It's absolutely imperative to ensure that local actors do take ownership of all the programs and projects that we roll out. And I think for me, our most recent experience has been part of the work that we're doing with our Kenya office, together actually with USAID, on a project that's known as Imarisha Jamii. So we're actually trying to roll out our One Health approach in health programming. And essentially what we did was engage that particular region of the country and ask them, what would it mean for us to be able to come in and have a One Health approach? What does that look like for you? And what was magical is that community actually organized itself through all tiers of leadership. So from the governor to his executive committee, to then his country directors, to then his facility health managers, were actually able to put together what is known as Kimormor, which is essentially a coming together of the Ministry of Health, the Ministry of Agriculture, the Ministry of Environment, together with community leaders. And they've defined that as a structure that they want us to utilize when it comes to ensuring that facilities have the commodities that they need. And so it's absolutely crucial for us to be able to ensure that, as Amref, any project program that we're running is actually endorsed through Kimormor. And what's interesting is that this setup, this transfer of power and ownership has actually led to preliminary improved indicators in stockouts, because then the whole community is partisan in a health facility when it comes to ensuring that things are moving. And so for us, ownership and leadership is absolutely crucial. And it's important to always be cognizant of, I would say, what would be the formal tiers of ownership, but also the other community elements that would come in creating ownership of a project and program. I think participation and engagement has been very useful. When we do our annual work planning, we actually do engage the structures that I've just shared with you, and they're actually involved in part of the validation of the work plan for the project execution. And so they feel that they're part of this and that they own this. I think also a very interesting element has been in capacity building. One of the things that we've been running as Amref is a project on respectable maternal care in Zambia. And the target was to be able to ensure that we have mothers coming to health facilities and that they're receiving skilled delivery services. What we realized is a huge component of that is, of course, respectable maternal care. And when we were rolling out our program, the nurses and midwives themselves have actually been involved in co-designing what respectable maternal care means and how it would reflect in that cultural setup in Zambia. And again, we're seeing more mothers coming to facilities. We're seeing better postnatal follow-ups, post-delivery. And, it sort of makes you realize, if we truly center our projects around the key actors at the ground level, that we can perhaps reap some dividend just from tweaking that little approach. If you look at partnership and collaboration, we've done some interesting work in Tanzania and Kenya, where we've actually introduced what is known as an OCA process, so an organizational capacity assessment process for our sub-guarantees. And essentially, from having to work with about 10 partners in the beginning of a 2-year term, 3-year term, Amref now has 70 community-based organizations who are working with Amref, and we've worked with them to improve their systems. And this includes their fiduciary financial systems, their HR systems, their capacities to be able to work with us. And again, a lot of interest in that area. As an organization, we have several convenings with different CSOs where we come together and try and improve their capacities and capabilities in being able to sound off with communities and really implement the programs that we are running through them. And I found it remarkable in our last leadership meeting where, one country office was saying, I started with 10 partners, now I'm at 70. That's building capacities of the communities. And then, of course, contextual adaptation, very, very key. We've run different programs where, particularly in the nomadic parts of different countries, where we've come to learn that you do have to understand cultural norms. You do actually have to engage community leadership when it comes to programming. And I think one of the successful ones we've had is where mothers, together with their partners and village elders, have actually come in to tell us, putting for me a mama kit that looks like this, so a delivery kit that looks like this will actually create incentives for this mother to be able to come to the health facility. And, just through that approach, again, we're seeing, better outcomes, an improvement in terms of a health-seeking behavior in this community. So for us, ownership and leadership is key. Participation and engagement is absolutely crucial. Capacity building, partnership and collaboration, and then contextual adaptation. As I speak right now, we're engaging on a health financing engagement with the government of Nigeria in one of the states. And in one of the sessions, the Director General actually came up and told us, you know, this is my raft of priorities as you engage with us on strategic health purchasing. These are the answers that I'm trying to get from this exercise. These are my questions. How do you tailor your engagement with me so that with on each and every day, I'm getting answers to these specific questions? And I think it all goes back to really ownership and having this, you know, countries and all the different, should I say, array of local actors involved. And perhaps as I come to an end, I think what is going to be very important for each organization as they move towards this journey of localization is to appreciate that there are different actors, right? So it's not just the local organizations. We're talking about governments, communities, the political class, and other influences within communities. And so all our strategies have to sort of look at that heterogeneity when it comes to what it means to localize. Thank you.
Thank you. And I think you started it with an example that highlighted how you were able to pull multi-sectoral actors within the community to come together to a solution, and you ended it with that. And I appreciate that because there is often silos amongst sectors as well, and doing localization adequately means bringing all of these sectors also together because they all impact communities. And I think I like what you said in relation to trying to find solutions with local actors, because that's where innovation and creativity is, and that's where we could design solutions that would incentivize communities for behavior change, for perspectives change, just like we initially said. So I appreciate that. Thank you, Dr. Mercy. Dr. Mai, over to you.
Great. And actually, it's really wonderful to be able to hear how different organizations are really approaching taking this localization concept forward. So maybe with my comments, I can add a little bit to Kumanan and Mercy's perspectives of what it means to take a big agency like USAID that operates in many countries and make this actually a wholesale systematic change. So as I noted before, you know, USAID aims to shift the focus to local actors and communities and ensure their voices are driving programming. It's not that we haven't done this before. I think like Kumanan noted, it's just that we can, and Mercy have noted, that we can do a better job. We can do more. So it's not new. We just need to do more, and we need to do a better job. So when we include diverse local stakeholders in decision-making processes about the health system, I think we all know that this can lead to innovative solutions and also result in higher quality healthcare, reaching those, especially those who need it most and don't have as much access. So when solutions are locally driven, ownership, accountability, self-reliance are strengthened. And this is really critical for ensuring that we're building resilient health systems. So one example maybe that I can share is some of the work that USAID has done in Malawi, where the agency has helped the government develop a community health strategy that includes community structures, such as health center management committees, community health action groups, and village health committees as part of the national strategy, to engage communities in the governance of their own health systems. So that voice being really, really critical coming from the community. We also understand, as others have said, that it's not one size that fits all, that we need to tailor how we engage with local partners, how we strengthen capacity, and how we align to the local context. And then these local organizations and communities can really help us shape what we need to do to improve systems. I'm going to also note that the time required can also vary depending which country you're working in, depending on which partners you're working with. So we have to be patient and enable that to happen. So the process to strengthen capacity at local levels within a government and with civil society is really a multi-year effort. It's important we recognize that these changes do not happen overnight, and we need to be as flexible and intentional about our support as possible. Our success also relies on ownership and leadership across all levels of an organization, including host country governments, as well as, of course, USAID. It takes immense coordination and collaboration with technical and programmatic teams to shift how we and other organizations and institutions do business. It also requires our implementing partners and partner governments to support locally led initiatives at the national and subnational levels and provide local actors with the flexibilities needed to operate effectively and efficiently within their own communities and systems. I'll share another example. So with our work under PEPFAR, in recent years, USAID was able to significantly advance its investments in local partners, moving from a baseline of about 35% receiving direct funding to close to over 60% over a 4-year period. So that is actually a huge move within a given program area. Now, that took considerable coordination with our mission teams working across technical leads, acquisition and assistance staff, our program offices, our general counsel, our legal folks, and financial management staff to closely coordinate on new and updated procurement models, and also the guidance for how we can work. So I think when one thinks about USAID as a large bureaucracy, one has to think in systems, and systems that move forward ideas, approaches, processes forward in a systematic way so that they can be applied across countries. So that takes time, it takes coordination, including when offices don't always work together on details. So another dimension of advancing the localization agenda is ensuring that USAID programming aligns with and supports partner governments' priorities and processes. So I just want to note that USAID is also looking at opportunities to advance government-to-government agreements, and these can be complex and also linked to specific country risk assessments. And I can talk a little bit about that more later. And we still do recognize that there are gaps in the available evidence regarding the most effective and most sustainable ways to ensure that integration of local voices is successful and that local leadership is supported. So we're also in the business of continuing to share and document what's working and what is not. And by taking and embedding a continuous learning approach, it will really help us identify those approaches and solutions to more effectively encourage local influence and support local leadership in our health system strengthening programs. Thanks so much.
Thank you, Mai. Yes, we need continuous learning for us, for the communities, for all the actors, so we can collectively learn together, adapt together over time. And I really see some common themes fitting here in terms of co-work planning and what Kumene mentioned about the co-design and you mentioned, Mai, this is not a one-size-fit-all, and Dr. Mercy mentioned contextual adaptation. And I think those are the things that we want to take and move forward with and try to expand on as we implement with locally led development lens. But additionally, I think, as Kumenen mentioned, most often our technical assistance is short-lived, right? And for us to foster ownership, accountability, responsiveness to local needs, we have to build sustainability. We have to think about the sustainability. And you mentioned this, for example, Mai, in the G2G mechanism that USAID is supporting. And so can you share a little bit of your thoughts on opportunities to push the localization agenda forward to contribute in a meaningful way towards sustainability of the interventions we're doing and institutionalization, as Kumenen originally mentioned. And maybe we could start with Dr. Mercy.
Thank you, Mariam. I think for me, just borrowing from what Mai said on evidence, to answer the sustainability question, I think organizations are going to have to be deliberate and intentional when it comes to generating evidence on what works and what doesn't work, and perhaps even defining, the essence of what sustainability would be. I think in a perfect world, in a good petri dish, experimental petri dish, we would want that local actors and institutions do take full responsibility and continue on with programmatic support. I think for me and particularly for Amref, one of the things that we trying to reflect and sort of come up with an answer to is, what does it mean when we say that this intervention was sustainable? Is it sustainable because it was picked up as a policy measure by government? It's sort of an egg and chicken question. You know, is it sustainable because it demonstrated results, and we therefore then hope that this programmatic approach would be adopted by local communities? Is it sustainable when Amref is able through the OCA process to actually have that transfer to local organizations who then can do this in the absence of our organization? You know, is that then our measure of sustainability? So I think for me, perhaps that's the biggest unanswered question. You know, is localization part of the puzzle to achieving sustainability, which we know all actors really have been sort of singing and crying for. And sadly right now, Miriam, I don't have an answer for you, but it's definitely, I think, the biggest elephant in the room right now. You know, how do we define it? How do we measure it? How do we actually see that thread being woven and start sort of imagining that soon we'll have a good, lovely fabric of sustainability? So not the answer you'd be expecting right now, but I think it's definitely something that we need to all think about individually as organizations and collectively as leaders in global health. What does this truly mean? Is localization part of the answer to this question? Yeah.
Thank you, Dr. Mercy. And I appreciate the raising a question for the question. And that's what this conversation is about, trying to collectively find answers. Mai, over to you.
Okay, so maybe I'll pick up a little bit on the theme of sustainability. And we talk about sustainability in our programs in many, many different ways, but how does localization really support that? And I think for anybody who has worked with USAID, applied for grants or contracts or awards with USAID, knows that it actually is a very intensive and very difficult process. And that in of itself can build huge capacity in business processes and accountability, financial tracking, et cetera. But now our aim with localization is not necessarily just to build the capacity to work with USAID, it's really to translate some of these concepts into the leadership and into the permanent capacity levels of the countries that we work with. I wanted to just say that we know that there are many institutional hurdles that we still need to work through at USAID in order to make significant progress to our localization goals. And that just really means, once again, going back and looking at our business models, how we do that, and to just be very, very attentive to many of the details that maybe have been there for many, many years. So as we look to make some of these changes, these really include looking at our policies, our processes, our staffing. Are we staffed appropriately to support localization as we move forward, or do we need to actually be thinking about new skills there, more staff to support, local capacity strength and other things that maybe in the past we weren't organized in that way? Also, funding decisions. As we know, as a funding agency, funding decisions are absolutely critical in terms of how we either enable or don't enable certain goals and initiatives to move forward. And these partnerships and programs that we're trying to put forward really need to be looked at from all these perspectives of how we've done business in the past and how do we want to move forward. Now, recognizing that there are many partners that we work with, also in the area of health system strengthening, we need to be looking at that full landscape and say, how do we maximize pulling, crowding in all of these actors to really influence where we go? To really focus on that goal, I'm going to bring us back to sustainability, to advance sustainability. When we think about health systems, maybe for the most part, many of our conversations and funding focuses on the public sector, but we know that we have the private sector. We know that we have many other organizations, research and academia, as Kumanan mentioned, but also faith-based organizations, also civil society organizations. And as a whole, these organizations can really come together to influence how we shape our health system strengthening programs. So not to go to each type of stakeholder individually, but what are the opportunities to bring them together? I do want to note, though, in the area of health system strengthening, we do need to work more effectively with governments as they have a critical responsibility for delivering quality healthcare and health programs to their citizens. So these health-funded government-to-government agreements that we still have, I will be honestly say, space to grow in those, but especially in the area of health system strengthening, if we want to have impact, to think what might work at a national level and what might work at a subnational level. We can't forget that subnational level that is closer to our communities, but also reflects the need to build capacity at local levels and not only operate at the national level. So keeping that in mind, I think we want to also help incentivize governments to build out their reach to communities, to build out their reach to civil society, and in that way help with transparency and accountability to also pull in the various communities in the decision making. Maybe just a couple of other points that I just want to say that overall our Global Health Bureau is really energized and focused on supporting and moving these agency goals forward. We have intensive discussions on a regular basis within the Bureau, and we challenge each other to think differently. We're looking at our central funding. We're looking at all the funding that goes into our mission mechanisms, into our own mechanisms that support missions, to really try to understand what is our baseline today and where do we need to go. So maybe I'll stop there, but thanks very much.
Thank you, Mai. And I think a few key words that really resonate is the whole of society approach to health system strengthening, taking a systems lens, but more importantly, incentivize change and behavior change at the government level in the way that they engage with their communities. And that is part of it. And that is part of how we could drive towards sustainability. And maybe that brings us back to one of Kumanin's initial points about institutionalization. So over to you, Kumanin, on strategies and approaches to drive towards sustainability.
Yeah, thanks, Mariam. And I think, Mai and Mercy have shared such richness in their comments, so I'll try to add to that. I identify sort of three types of opportunities at the moment to take forward this type of ethos, whether we call it localization now or a primary healthcare approach before or subsidiarity. I think firstly, we have just lived through an experience with all of these multiple crises where this is not just a morally right way to go about it. If we want to be effective, we need to take this forward, right? We are under strain. Systems in all of our countries are under strain from our multiple crises. And when you have a crisis, it is at the local level and communities that people have to work out what to do, regardless of what resources are afforded to them from the national or the global level. So that does, it can sound a bit cliche to say, but that affords innovation. But we've seen so many innovations over the last few years, and this happens whenever we have a health crisis. I mean, I remember in the context of Ebola in West Africa, conversations with community leaders and community workers in places like Kakata and Liberia, talking about their experience during Ebola and all of the extra responsibility they took for their communities. But also, in a way, they reflected that they had greater agency and autonomy, because often many of the orthodox services were reduced, and so community leaderships, communities had greater access to resources and greater ability to make decisions. And often when crises are perceived as over, a lot of that decision space gets taken away. So maybe this time, when what we've seen with COVID, where borders closed, so there were no longer fly-in, fly-out missions from global partners, where a lot of foreign workers left countries, and where people and I saw that myself in Cambodia, where local and national leaders really came together, used the resources they had. So we have a lot of experience over the last few years. So let's not lose that, and really we can take that forward. I think the second opportunity is that we know a lot about this. There's existing research and evidence, and I think we should be careful not to, as I said before, romanticize this idea of localization. It's not an either or. Often in global health, we swing the pendulum from one direction to the other, but we should know better. We can look at previous experiences with primary healthcare, which often just got reduced to community health workers trying to deliver by themselves, poorly resourced as a substitute. We can look at our experiences with decentralization, which often just gets interpreted as asking the subnational levels to deliver or communities to deliver, but without the resources in the national system. So it's not either or. So when we're supporting localization, you still need strong national level supports and systems. You still need us as global partners, as I think all of us are committed doing on this webinar, to do that support. And again, going back to the principle of subsidiarity, that didn't mean that there weren't any decisions that didn't need to be taken above the local or the family unit. You still need national structures and global structures, but everyone needs to do their job well in a coordinated way. And we're talking about priority perspective, but not abandoning. So we can learn from previous research and evidence. That's an opportunity for sustainability. And then the final point, and I have to say this is the leading the Alliance for Health Policy and Systems Research. There's an active, and I think this is what Mercy said as well, there's an active learning agenda that we need to take forward. So we need to support that, not on the effectiveness of just individual interventions, that's important, but really learning, continuing to learn and iterate as to how do local systems work, how are they integrated into national systems. That is the primary healthcare approach. We've just struggled to implement it and resource it sufficiently. So we need an active implementation research agenda, an active policy agenda to take forward, building on what we already know, but continuing to monitor, to learn, to iterate, to course correct, to improve. And that also is key to sustainability. That's, yes, building community, strengthening capacity in countries, but we should also look at ourselves. We need to strengthen our own capacities institutionally, at national level, at global level, to support this sort of mission of localization. So I think there are a lot of opportunities, and now we just need to do the work.
Very well noted. Thank you very much. Learn from our past experiences, but also keep in mind continuous learning from what we are currently implementing, monitoring, adapting to our successes and challenges. I really appreciate all of your great input. And we have now reached the questions and answers session. We have received a couple of questions that the team has shared with me, and maybe I'll start with the first question. What are the main challenges to institutionalize localization for strengthening health systems in low and middle income countries? And what have we learned from previous attempts? And again, we have been talking that this is not something new. There is renewed effort, renewed commitment now, but this is something that we have been trying to achieve for quite some time. And so focusing maybe on the main high-level challenges that require us to continue to renew those commitments. Anyone from the panelists?
Maybe I'll go ahead and start and share some thoughts there. So in order to institutionalize localization, I would say from an agency perspective, first, these programs take time. They take many years. And I think we need to figure out how to institutionalize, number one, in our own approaches, right? So that we have consistency and a long-term vision for doing this. And I think that's why it's important to kind of build a really strong foundation in our own processes, our business models, our policies, our guidelines, because those things will then allow us to invest long into the future as we go and encounter challenges that may change or vary, but then we've got the foundation internally. So I think that's really something that we're focused on building right now. It's not a step that one can skip, because then otherwise you don't have that long-term consistency. So maybe I'll just add that as a perspective from USAID so that we can kind of hold the line and stay focused. Thank you.
Thank you. Dr.
Charlene?
Moss?
Yeah, great. I think supporting both my fellow panelists, is that we need to appreciate that there's a runway and there's a time horizon. And so the idea is to, as institutions, as agencies, to sort of have that appreciation of the runway that we need to go through, and then to be systematic and deliberate in actually being able to measure. Part of your own, I would say, self-appraisal mechanisms as an institution should involve some thought out process of how you'd be able to tangibly measure this. I think what I've enjoyed, for me from this webinar is Kuman reminding us that, this was discussed all the way back in 1978 during the Almata days. And so it's not anything that is new. Perhaps right now the push is to actually be able to tangibly be able to measure progress towards it. So I think that's really valuable and important. And I think I think organizations should extend this discussion within their immediate stakeholders. As Amref, we're being very deliberate to actually engage governments and other actors as to what does localization mean for them, even as we continue implementing our new corporate strategy. What would it mean for them? What is that tangible aspect of it from their end? And what is interesting is that it all comes back to primary healthcare. Everybody keeps talking about people-centered healthcare that is responsive to community needs, that takes into account community needs. And so I think we more or less have the answer. We have the blueprint. We just need to get going and keep course correcting as we move. Yeah.
And then maybe if I could add, and also looking at some of the other questions in the chat. I mean, as much as we're passionate about these types of community-led approaches, I mean, it is a lever. It's not an end in itself, right? And communities will judge the success or failure of these on whether they're actually getting the services they need, or whether they're supported to improve their health or support their aspirations. I mean, one of the challenges of a primary health care approach, which we continue to say is the way forward, and we agree, is that often communities didn't feel that they were getting the services they need through the implementation of that approach and policy, right? And so they went to where the services were. And I mean, choice between no services at local level or going to a hospital or whichever quality vendor you can get privately, people will choose to get a service, right? So we really need to judge the success of this not on, the words we're using are important and we know them, but things like localization, institutionalization, health system strengthening, they're not very meaningful words to most people, let alone try them in translation, right? So I think it's important that we just see them as a lever, as a tool, but then we judge their success. Are we actually improving service delivery? Are we actually improving health outcomes, right? And so I think for that, then it is really engaging with the political economy and the ecosystem, again, more big words, of systems, health and social systems. It is whole society, people's countries, and thinking, well, what makes sense, and not being sort of almost doctrinaire that it must be this type of localization, right? I mean, is that what people are asking for? It will depend on the size of your country, the ethnic and cultural makeup of your country, the history of the health system of your country. And so, again, I think being humble about that and saying this is a good faith attempt to recognize that we do need community leadership. I think the other thing in the comments, of course, was what happens when we have universal rights? And then sort of local priorities differ from those, you have in countries, you do have marginalization, you have structural discrimination in all countries, all of our countries, right? And so what is the role of us as global partners? So as I said, it's not localization as an end in itself, it's localization as a means. And it has to be linked to all of these other considerations. We need to take a systems approach. We need to engage with complexity, learn from these last lessons. But I think what we've seen is that I'll finish with, I remember many years ago, I was working at UNICEF, and we were doing some work in far western Nepal in Humla district, above 3,000 meters in the Himalaya. And we invited a member of parliament to come with us. And I remember trekking after you land at Sivakot, about several hours at 3,000 meters to a small village, and meeting some female community health volunteers who were some of the most inspiring cadre of health workers on the planet. And they just spent the next hour and a half presenting to the MP, mainly, about all their challenges, what they needed, with data. It's that impulse that we're trying to capture. It's that sort of local leadership of people sited in communities who know what's needed, who have some answers but need resources and support. But that doesn't work if we're not linking with the monitoring, with the knowledge, with national level policymakers, national institutions, and thinking then how we in the global system are providing useful support. So that's the sort of vision. And really now we need to monitor the implementation of that within our own institutions, but also within countries and at local level, and seeing does it make a difference to advancing towards universal health coverage.
I think you mentioned something very important about not going with a preconceived understanding of what localization is, but understanding the system and appreciating the system dynamics and what localization even means in different contexts, and then having an open mind about adapting our approaches to what suits a specific context. There are so many questions in the chat. Unfortunately, we have 5 minutes to go. And maybe I will ask one last question and then turn it to our panelists for their closing remarks. One of the questions is, how do we ensure that we embrace the capacity status and the challenging context in which local organizations work and adopt risk adjusted approaches to get funding to the front line quickly that can still adequately account for the satisfaction of the donor? Do we need to decolonize risk? And inherently, I think this is a very important question as we focus a lot on not only engaging local partners, but also putting them at the forefront, building their capacity and in the decision making. And that is associated with risks just because of the context in which these local organizations operate. So maybe we'll start with Mai for your answer and closing remarks, Mai.
Yeah, thanks so much, Mariam. And I think that is a really excellent question, and really one I think that goes to the heart of why, when I started speaking about changing our business processes, our models at USAID, why it actually takes time. Many of the processes are linked to how we manage our funding, how we can be accountable to Congress, how we can, in essence, really manage risk, and then ensure also that dollars are used, funding is used wisely. However, I think we recognize that if we are serious about localization, we've got to open up those parameters a little bit, or things are just not going to move, right? If you want to just be perfect all the time, you're only going to get so much done. So as we look internally, discussion of risk is such an important piece. And where I would say is where it would be really great to hear from stakeholders, from the community, from our partners, even all of our implementing partners that we work with, what are some new models that we can build so that we can have risk, but at the same time, also in parallel, try to ensure that we can also focus on getting to the results that we want, right? So what are some of those new models that we haven't applied yet? We don't have to be stagnant. We need to be very forward-looking, and we really welcome good ideas in that space. Not every award, not every contract has to be a huge amount of funding. You can manage, especially if you're working at the community level, to try new things. It doesn't have to be a high-risk venture. And I think this is an area that as an agency, we should really challenge ourselves with. The area that I mentioned for G2G's, government-to-government agreement, that needs also some openness around risk, and I would say some creative contracting, some creative MOUs, where we can find ways to work with our partners, both government, both civil society, but then maybe also look at private sector. So very open to hearing good ideas. Just will wrap up by saying thanks so much for a great webinar. It's been really wonderful to have this conversation, to hear from Kumanan and from Mercy, and I look forward to all of us holding each other accountable as we move forward this ambitious agenda. So thank you so much.
Thank you, Mai. And over to you, Kumanan, for your final remarks.
Well, I mean, I'm just reading through the chat questions, and there's so much that we haven't addressed. But I think, I'm so grateful. Thank you, Mariam, and it's been great to listen similarly to Mercy and Mai. And there's so much here, but it's a very challenging sort of issue. I think in summary, I mean, that question about risk is a good one. And I think I don't have so much to add to what Mai said, except to say that in many ways, one of the main values of supporting local leadership and community leadership is that it allows you to sort of think of not just the easy places to work with great governance and great supply chains, and where people are willing to go from outside and you can get rapid improvements in short terms, but it really is in challenging contexts where, as I said, local communities are leading. Like many of us in our family histories, we have sort of some experience as diasporas or directly of conflict. And that in communities, like the way communities in conflict, it is all about locally led solutions, and expatriates and diaspora communities within countries, they find ways to get resources and money to people in those settings. And it's not necessarily through the traditional challenges, it's often through community organizations, right? So maybe we can also be humble and learn a little bit from that and think about how we manage risk, because you still very much see results there right? So I think that is a very good point that has been made. I think I'd just like to say again, though, I really welcome this focus on what we're talking about is localization here. It is very important that it's not our agenda as a global agenda. It is very much supporting the very different agendas at local level and engaging with national systems and contexts. And again, I'd like to congratulate Mai and our USAID colleagues because it does make a difference. I mean, you're not the only player, but you're a big player and you're a big funder. And it's both it's not easy. I know how difficult it is to turn the ship. So we really look forward to supporting you on that. And as you say, I mean, hopefully working together, learning together, holding each other accountable. And just thanks again for inviting me for this, to take part in this very important and interesting discussion.
Thank you, Kumanan. Over to you, Dr. Mercy.
Thank you, Kumanan and Maya and Mariam. You know, for us, just really excited to be part of this conversation and echoing, you know, all actors who really are bringing this to the front and center of all our thoughts. I think it's going to be important to remember, as Kuman said, that this is a means to an end. It's not the end itself. And so in all our thinking, in all our projecting, in all our designing of new business models, the idea is to remember that we are trying to move that dial and needle when it comes to UHC. And so I think sort of always being clear on the targets will help us as we navigate these murky waters. And really from my end is to appreciate USAID, APT, WHO, the Alliance, and everyone really for coming together to discuss this and to extend our continued thoughts, hand-in-hand leadership with yourselves as we walk through this journey and support countries.
Thank you so much, Dr. Mercy. And I want to extend our deepest gratitude to our esteemed panelists for sharing your profound expertise and valuable insights with us today. This has been a thought-provoking, interesting conversation, shedding the light on the power of localizations in health system strengthening. And I want to thank our participants for your active engagement and thought-provoking questions. Thank you all, and we look forward to crossing paths in future webinars. Thank you, and have a wonderful day.
Thanks so much.
Thank you. Bye-bye.